Good afternoon, ladies and gentlemen, esteemed guests, members of the media and journalists. Thank you for making the time to come in person or by virtual to participate in today's press conference. Today, Thursday, 27th of October 2022, I welcome you all to the inaugural day of the second Health Ministers meeting in this beautiful island of Bali. After the successful of first Health Ministers meeting, which took place in Yogyakarta in June 2022. Presiding with us, His Excellency Minister of Health of the Republic of Indonesia, Mr. Budi Gunadi Sadikin, and Director for Global Health and Technology Policy, Mr. Bonanza Taihitu. To start things off, I would like to invite Minister Budi Gunadi Sadikin to give a brief description of the day's event. Minister Budi, please, the floor is yours.
Thank you, ladies and gentlemen. As you remember, Indonesia has put 5 ambitious deliverables that we would like to achieve in this G20 on health. The first one is we would like to establish a fund for the future pandemic, and we have successfully done that in June and July, and now 18 countries and institutions has pledged around 1.4 billion, US dollar. Second deliverables, we would like to establish a formal mechanism how we can use this fund to give access to emergency medical countermeasures, which is vaccine therapeutics or medicine and diagnostic tools, equitably. So all countries, regardless their economic conditions, can have access to this emergency medical countermeasures using the fund which is available. The third objective, we would like to establish a network of genome sequence lab globally as an early warning measures. If a pathogen, can be virus or bacteria or parasite, appears in one country, we can quickly recognize, understand this, the biology of this pathogen, and then design a diagnostic tool or medicine or vaccine against these pathogens. The fourth agenda, we would like to have a standard global health passport that can be used by people during the pandemic so they can still move around the world. And this digital passport or standard protocols, health standard protocol globally will using a lot of digital platform. So it will be easier for people to move around. And the fifth agenda is we would like to redistribute globally the research and development capacity and manufacturing capacity for emergency medical countermeasures such as vaccine, therapeutics, and also diagnostic tools across the globe, not only in developed country in the north, but also in the developing country in the south. And to deliver those 5 agenda, we split the group into 3. The first health working group, they have their own meeting to address the digital technology in harmonizing the global health systems. The second working group, yes, this talking about the number 1, number 2, and number 3 deliverables, which is the establishment of the fund, the uses of fund, and also establishing network of genome sequencing. And the third health working group, which is dedicated to discuss about how we can redistribute the research and manufacturing capacity globally on vaccine therapeutic and diagnostic. On top of these 3 working groups, we also have side events. This is another track of G20 health working groups that involving the other side, the non-government institutions, to talk about important health issues globally. The first one is tuberculosis. It was led by Stop TB organizations, and by next Friday, hopefully they can come up with an output call to actions document outlining the milestones of the effort of to increase the funding to eliminate tuberculosis by 2030 from developing countries. The second side event is the side event on One Health. The discussion is led by 4 organizations, global organizations: WHO, Health, UNEP, Environment, FAO, Food, and WOAH, which is the animal. Because One Health concept, we notice that almost every pandemic, the pathogen can be virus or bacteria, usually live in animal, and then because of certain environmental issue, they jump to human being. The same like this, SARS-CoV-2, the COVID-19, the virus used to live in the bats and then move to human. Or the bird flu, it used to live in the bird and then jump to human. The pig flu, the same thing, it used to live in the pig and then jump to human. So that's why the concept of One Health to prepare for the future pandemic must involve not only WHO, but also WOAH, which is World Organization on Animal Health, UNEP, the environmental arms, and FAO, the food, global food organizations. And hopefully again, by Friday, they will have an output of One Health joint plan of actions. And the third side event is on antimicrobial resistance. This event is led by Fleming Fund to make sure that we don't overuse the antibiotics. Because we overuse antibiotics, then basically these antibiotics can make the bacteria to mutate, and then the antibiotic will not be effective anymore. And to develop the new antibiotics is so extremely difficult. So hopefully also in Friday we will have an output call to actions on this AMR. By the end of Friday, what we are expecting to have is a consensus between G20 countries on the health issues that we face globally and what are the plan of action to prepare the world for the next pandemic. We realize that the fact is geopolitical tension happens, especially because of the war between Ukraine and Russia. But all of us, the health ministers, believe that the global health issue is much more important and we need to focus on this one. And it is our job as the health ministers of the top 20 biggest global country in the world to make sure that we can set a foundation, agree by consensus by the G20 member state, to be used as the platform for the future global health architecture. So I stop here, and I have to thank all the team that have been working so hard. I heard yesterday or this morning they work until 4 o'clock in the morning to make sure that we can finalize the document. So I stop here. Pak Bona, do you have any additional to add, or then I leave it back to you for question and answer?
Thank you,
Please.
Minister Budi. We will now start the question and answer session. For our online participants, please write your questions into the chat box and I will read them out. We'll start with any questions? Yes, please. Please introduce yourself.
Terima kasih, izin saya bahasa Indonesia ya Pak ya. Saya Fitri Liputan6.com. Ada 2 pertanyaan Pak terkait soal yang berbagi data genom sama untuk yang jejaring manufaktur. Itu diskusi apa yang sepertinya masih sulit begitu Pak? Artinya itu bisa diteruskan mungkin untuk presidensi berikutnya. Yang kedua soal protokol kesehatan sertifikat vaksinasi. Untuk kita kan masih pandemi ya, apakah kalau misalnya setelah WHO mencabut status kedaruratan, untuk sertifikat vaksinasinya seperti apa? apakah masih berlanjut dan itu sudah didiskusikan juga di antara negara-negara G20. Terima kasih Pak.
So I will answer question number 2 first gitu ya. If the pandemic is over, so WHO declare that it is not a pandemic anymore, what is the use of the health passport? So learning from this pandemic, we can see pandemic happens continuously in a cycle. So this definitely will not be the last pandemic. Our experience during this pandemic, every country did a lockdown and people cannot move around. When people cannot move around, essential goods cannot move around too. So when essential goods like food, energy, emergency medical countermeasures cannot move around, then it creates economic issues, it creates social issues, and create political issues. That's why we believe this global standard on health passport, digital base, can be used for the future pandemics. For the future pandemics. If something happen, we already have the platform globally, recognized globally. And what I'm very proud of is the standard that we use is a W standard, using a QR codes, WHO format, and this has been agreed by all countries and will be submitted to in the international health regulations. So every time we have a World Health Assembly every year, we can submit or propose modification or additions of the international health regulations. This international health regulation will be followed by all WHO members. So we have agreed Indonesia will submit this standard digital passport into the next World Health meeting, WHA meeting in Geneva, to modify the international health regulations. The questions number 1 is related with the distributions of research and manufacturing. It will take time. It will take time. I give you another example, the establishment of the fund itself. It started during Italian presidency. Because it cannot be finished, then it is being transferred to Indonesian presidency, and we finish that. So I strongly believe in terms of this research and manufacturing capacity for the developing countries, it will take time. Our job is to establish a platform. Hopefully the output will be 7 countries that is member of G20, but located in the south of the globe. The south of the globe is usually poorer than the north of the globe. You know? South of Africa, which is South Africa, south of Asia, which will be Saudi Arabia, India, and Indonesia, and Turkey, and then south of America, which we have 2 G20 members, Brazil and Argentina. So 7 of us has agreed that we will establish a network, formal network, so we can share knowledge in terms of research and development and also manufacturing capabilities. Thank you.
Any more questions?
Terima kasih atas kesempatannya. Pak Menteri, saya ingin bertanya ini, tadi sempat disampaikan bahwa ada poin pembahasan terkait TBC ya. Dan itu Indonesia kan masuk 3 besar ya untuk negara TBC. Dengan TBC itu, terus data dari kementerian sendiri bahwa angka TBC di Indonesia mengalami penurunan meskipun hanya angkanya 0, sekian seperti itu. Nah, boleh Pak disampaikan gambaran secara umum bahwa posisi penyakit ini, maksudnya TBC di Indonesia itu dibandingkan negara lain itu seperti apa Pak? Dan penurunan yang di tahun sebelumnya itu dikarenakan apa? Apakah memang dari kementerian sendiri punya trik khusus atau seperti apa sehingga angka ini bisa menurun? Dan apakah dari cara-cara yang mungkin dirumuskan tersebut bisa menjadi solusi ke depannya? Kalaupun ada solusi baru itu, apakah sudah ada yang bisa direkomendasikan dalam pertemuan nanti Pak? Terima kasih.
tuberculosis is an infectious disease. So infectious disease, the framework to contain infectious disease is basically we have four framework. The first one is the health protocols. It's like COVID. Health protocol is you have to wearing mask, you have to wash your hands. So those are the health protocols. In tuberculosis, the health protocol is we have to make sure that our environment is healthy and clean. Usually tuberculosis happens if we have a house which is not clean and not well ventilated. So that is one part of the jobs. The government need to educate our people about health protocols. In tuberculosis, health protocols mean you have to have a healthy, well-circulated, living home. The second framework on tuberculosis and any other infectious disease is surveillance. Like in COVID-19, surveillance means we have to establish a laboratory network that can do PCR tests. Once we test positive, we need to submit to the center and then treat the guy, whether in quarantine or sent to the hospital, or give them medicine. And then we have to make sure that the contact of this particular patient is also identified and being also tested. So the same thing happened with tuberculosis. In surveillance of tuberculosis, we need to increase our capacity. WHO estimate 824,000 Indonesians has tuberculosis, but we only be able to identify even not more than 600,000. So another 200,000 of patients, tuberculosis patients in Indonesia, we cannot identify by name and by address. The dangerous things of this fact is that these people can, spread the tuberculosis to other people. So it is our intention, we would like to improve the surveillance of tuberculosis. Different way with COVID-19. COVID-19 need a PCR lab, PCR test. Tuberculosis need a TCM test. Almost similar. But TCM test, we don't have enough lab like PCR for COVID. And we need sometimes to combine with X-rays also. So a different type of surveillance. And then after that, we talk about vaccinations. COVID-19, the vaccine, we have many. They are very, very effective. Tuberculosis, we have a very old vaccine, which is the efficacy is extremely low. Now Indonesia is working with Wellcome Trust Foundation, Bill and Melinda Gates Foundations to include Indonesia as the locations for clinical trial phase 3 for the latest tuberculosis vaccine. Hopefully it will, finish by 2027. And after that, we can use the more effective tuberculosis vaccine. And the fourth pillar is about therapeutics. If you got sick of this infectious disease, you have to understand how to treat the patients. Tuberculosis, actually, we do have the standard therapeutics or treatment, which is you have to swallow the pills for 6 months. So the medicine itself has been identified. The difficulty is you have to do it for 6 months. And Indonesians are not the most disciplined, people in the world. Yeah? Not like other countries. So that's why we need to make sure we found a mechanism. I just talked with the Ministry of Health in India. They have a Bapak Angkat, Ibu Angkat. What do you call it? Foster parent. It's not foster parent that pay your living, but foster parent that can call you every week whether you have swallowed the pill or not. If not, then they will call you to make sure that you get the tuberculosis pills for at least 6 months.
Thank you. We have time for one last question, Minister. This is Marcio from AFP. First question, specifically what outcomes are expected to result from the second meeting? And the second one is, one of the goals explained by the Minister of Health is the establishment of a formal mechanism for the use of funds from FIF in the context of pandemic preparedness. What options are member states currently discussing in this context?
So definitely the first outcome is the establishment of financial intermediary fund. That is the greatest achievement. And it has been formally established, co-managed by the World Bank, and also WHO is involved. And 18 institutions, including large country, has pledged 1.4 billion. That is the first outcome. The second outcome is we all agreed that we need to formalize the uses of fund. And we agree that we will follow up on the previous model, like Accelerator, COVAX, where inclusively all global institutions, not only single one global institution, but several global institutions work together. Now we have got agreement with all members that we need to formalize this. The formalization itself will be continued and hopefully will be done by the next presidency. On the genome sequencing lab, we also have achieved an agreement that these genome sequencing lab, which is now is being scattered across the globe, different country, different format, we will agree that we have to work together. And we can share data together. And as a developing country, we ask when you are sharing the data, you will also get the benefit sharing by sharing this data later on. The fourth deliverables is on the global health protocol standard. As I mentioned to you before, all countries has agreed to use WHO standard. This is a digital QR code, and it will be managed by WHO. So the next pandemic happen, all information about testing, whether it's PCR testing or another type of testing, information about vaccine can be included in that digital code. So every time we move around, crossing different countries, then the countries that we are entering now know exactly whether we are safe or not. And we will update, and we agree that we already submitted the revisions of the international health regulations to include this initiative. So it will be adopted formally. It has been adopted formally by G20, but when we sent to World Health Assembly and accepted as a modification of international health regulation, it will be accepted by 192 plus members of WHO. And the last one is, as I mentioned, we had agreement with 7 South G20 countries, South Africa, Saudi Arabia, Turkey, India, Indonesia, Brazil, and Argentina, that we will work together to develop the research and manufacturing hubs in this.
Okay, thank you so much, Minister Budi and Mr. Bonanza, for your time. And to the rest of the esteemed guests and journalists, apologies to those who didn't make it to the questions due to the limited time. I wish you all a very